Over 30% of prostate cancer patients experience biochemical recurrence after definitive treatment. In this setting, PSMA PET has emerged as a superior imaging tool for detecting local or distant relapse at low PSA levels. But what's the true diagnostic yield of PSMA PET in these patients, and how does it vary by prior treatment, PSA, and metastatic site? This systematic review and meta-analysis included 43 studies and over 8,000 patients who underwent PSMA PET after radical prostatectomy or radiotherapy. Outcomes were stratified by treatment type, PSA level, radiotracer, and site of recurrence. Overall, PSMA PET showed a positivity rate of 60% in post-prostatectomy patients and 92% in post-radiotherapy patients. Detection increased with PSA, ranging from 48% at PSA 0.2 to 0.5 to over 90% at a PSA level of 2 or higher. Looking at recurrence sites, local recurrence and pelvic nodes made up approximately half of the cases. To conclude, some take-home messages are that early detection is feasible. PSMA PET identifies recurrence in nearly half of the post-prostatectomy patients at PSA as low as 0.2. Timing does matter, as a plateau in detection beyond PSA of 1 supports its use as a threshold for repeated imaging if the initial scan is negative. Third, in post-radiotherapy patients, PSMA PET is typically triggered by the Phoenix definition of a PSA nadir more than 2. However, this threshold, originally defined for conventional imaging, may underestimate PSMA PET sensitivity. The study suggests that earlier imaging, especially in patients with steadily rising PSA levels beyond the time frame of PSA bounces, could enable more timely and effective salvage treatment. Finally, tailored strategies are essential. PSMA PET positivity rates differ significantly by primary treatment, PSA levels, and site of recurrence. These variations highlight that a one-size-fits-all approach may not be appropriate. Individualized imaging and treatment strategies appear to be crucial to optimize clinical outcomes.